Topik Konversasyon. Et dans Topik Konversasyon, aujourd'hui, pareil, moi, dit, bon matin, aujourd'hui, nous causons la santé et nous causons l'obésité. Obesity in English, si nous sommes capables de dire avec un healthy lifestyle, nous causons en général. Et pareil, nous connaissons, c'est aussi pas un gagné panier avec obésité. Nous conversation aujourd'hui, il y a qui pour un peu en anglais, mais docteur, il comprend un petit peu créole. Avec 10 questions, capable de dire créole, na translate, mais si vous voulez avec anglais bien même, ou capable de s'envoyer une question en anglais et docteur, il va répondre. Et ça qui nous demande aujourd'hui, il y a figure familier ici, le bonjour, Cécile, de temps en temps, il rend une petite visite, courtesy visite each time. On bonjour Cécile. Good morning, Dr. Farouk.
Good morning, Carol.
Comment ça va?
Bien, merci.
Bien?
Bien.
Tout quelque chose ok en forme en place?
Tchigui.
Tchigui. On va prendre cause créole un peu là présent.
Qu'est-ce créole?
Un tchigui, non?
Yeah, tchigui.
Dr. Farouk, today we are going to address the situation in Seychelles on obesity. Let's talk about the situation in Seychelles.
Okay. First of all, yes, we have to know what is obesity. What is obesity? To understand what health condition called obesity is, like every big person we can call him obesity. No, or obese person. No, obesity means abnormal or excess fat accumulation in
overweight.
your overweight. But overweight and obesity are two terms that you use to describe like stage of how much fat accumulation in your body. So as we said, this is excess fat or excess or abnormal, either excess or abnormal fat in storage or accumulation in your body. Okay, so this is what describe obesity. So obesity based mainly on the fat, not the muscles, not the bones, like as a main component of this health condition. And obesity now is a major health condition, major health problem worldwide. It's not only in Seychelles. In worldwide there is
worldwide.
Yes, actually the World Health Organization announced that it's now announced as a pandemic. The rise of the prevalence and incidence of obesity and annually incidence of obesity now is increasing dramatically, like with some countries doubled or tripled over a few years the number, and especially in younger generations like teenagers and adolescents. Now we've been seeing like much obesity unlike before. Like usually in those age groups you are usually active and you know, having more proactive lifestyles, but still they have nowadays becoming like more fat and more putting weight in this younger age group.
Is it alarming in Seychelles? What are the numbers look like?
It is alarming actually, yes, especially amongst school children, because I'm telling you the numbers, if you saw the curves, like there was some studies and some surveys. Usually there is every year there is a survey and a screening and some measurements is done by the Public Health Authority and the Healthcare Agency, also with school health units. They do the measurement for the school children, like the height, the weight, and they check their also health behaviors. There is a very alarming figures over the past few years. Like they started some studies from 1998 till 2022, almost tripled the number or quadrupled the number of the number of the obese children in primary and secondary schools in Seychelles. And it goes also along with international numbers and international data also from all over the world, even like from developed and developing countries also. Obesity is much more rising nowadays.
What is the Ministry of Health doing about this?
The Ministry of Health, actually, there is a lot of activities. Actually, there is, I'm telling you, there is it's you know, obesity is one of the non-communicable diseases, okay, which is already included in many activities and many projects within the Ministry of Health. There is a school, I'm telling you, there is a school health unit that they do the measurement and they do the survey for the children. There is some we have the project, like there is a project called SAPIN. This is a project that is specialized for the non-communicable diseases, including obesity. Like all patients will come to clinics peripheral clinics for diabetes, for hypertension. For this, we usually we measure the weight and some the parameters, the body parameters, and there is something like this. And also for the patient who are diabetic and who are hypertensive, they are educated and they are like at the level of the public, of the primary health clinics. There is a educational project. There is a training projects for the patient, for the healthcare workers. Because now to fight against those diseases, as we will see later, we have to start from the beginning, which is obesity is a main risk factor for those health conditions.
In the very first beginning,
Yes.
the obesity, what causes obesity is what we consume.
Yes, what we consume. Actually, obesity is it's a multifactorial health conditions. Like there are, as we said before, there are risk factors for obesity, like something that if you have high risk to be obese or to put weight. Some of them are changeable, some of them are unchangeable, like we call modified and unmodified, yes. Because like some factors like genetic or inherited factors, you can't change your genes, your inheritance. But also there are modifiable or something you can change, which is the most important, the balance between the calories or the energy you consume and you expend. This is what we call like obesity comes from like a gap between the balance between the consumed and the expended calories or energy. Okay, so as a total, you must consume less and you should exercise. Exactly. Yes. Yeah.
Ça veut dire que le docteur peut dire en d'autres mots, pour les gens qui sont un peu obèses, nous avons besoin de contrôler un petit peu, manger en même temps, nous faire l'exercice. Beaucoup l'exercice est nécessaire, est très important. C'est pendant sa balance entre les deux, which brings me to this question. Obese people, they are at high risk of cancer.
Yes. In fact, there is a bunch of the health conditions that can rise as a complication or as an outcome of obesity. Many have been like scientifically proved that they are like as a complication of obesity, and some like there is no clear like mechanism, but there is association. Like some cancer, there's been like noticed that there are very strong association between those cancers and obesity. Like or the prevalence of many cancers now have been noticed that they increase amongst obese patients than normal individuals. So as we say, there are a lot of diseases like diabetes, especially type 2 diabetes is like a consequence or outcome of obesity, and it's a very, very strong prevalence of type 2 diabetes amongst obese patients. Hypertension.
What about fertility?
Sorry?
What about fertility?
Fertility is one of the health conditions that is affected by obesity. Nowadays, like when like couples go to see a gynecologist for like some difficulty of conceiving, first advice, if you see like the lady is obese, you advise her to lose weight, because excess fat, there is a lot of problem with excess fat and accumulated in your body. This excess fat disturb the hormone cycles and the balance between the hormones, which part of them the sex hormones like the testosterone and estrogen in your body. This balance is affected by obesity, because some hormones might be deactivated by the fats, some hormones might be changed in your fats, and when you have more fats in your body, those hormones will be like deactivated or changed much more than normal. So this, of course, the hormones, like the fertility relies on hormone balance. Everything in our body is controlled and balanced by hormones. So fertility is also a problem amongst obese. We don't say that when you are obese you will not be able to have children. This is not, but the risk of having difficulties of conceiving or even
having difficulties.
Exactly, and even difficulty during the pregnancy itself. All this are like increased by being obese.
Can it be cured?
Obesity, of course, yeah, it can be cured, yes. So, obesity, again, we need to see, like first, if we can see, we can show some slides also for our audience to be understand. The obesity has a stage. Like, of course, when you put some weight, it's not like when you put more weight. It's not like when you are severely or extremely obese. So with when you change from one stage to a different stage, the complication increase and the problem increase, and even the treatment is more difficult. Like if you want to lose 1 kilogram or 5 kilograms, it's not like when you want to lose like 20 or 30 kilograms. Of course, that treatment will be or the cure will be difficult. What we can say here, as I said, the balance between the expenditure and the consumption of kilocalories or the energy you use every day. The cure or the treatment should start as a prevention. What is prevention? Why we say that we have now like developed or adapted like more like tendency toward this obesity than the older generation? Because our lifestyle has changed a lot over the past decades, like from eating like more unhealthy food than before.
Foods, junk food.
Yeah, junk food now is almostly the daily dish for on the table dish for everyone, starting from that young age. And also we are more like tends to adapt a sedentary lifestyle now. Like we walk less. Like you look at the older generation, how long they used to walk every day to go to their work, to go and back and forth every day. I saw some people here, they used to walk from like Point Larry to Victoria and back and forth every day. Yes, every day. So this one will never have, even if he has some like extra weight, he will live healthy life. It's not only about weight. And how healthy food they used to eat before. They used to eat more like rely on fish. They used to eat more like vegetables, more like consume the natural food. They never knew that this newly like junk food and processed food like we rely on more nowadays.
Processed meat as well.
Exactly, yeah. So of course, so you have to start, the cure has to start from the beginning as prevention, that you have, even if you are not obese, everyone has to adopt a healthy lifestyle. Exercise is a must, and we're not talking about like intensive exercise, for example. We're talking about
hardcore exercise.
Or hardcore exercise. No, it's not like that. Because if you start like, unless you are an athlete or like a sports person, okay, you can adopt this. But if you are a normal person who's doing like ordinary work like us, like you just need to keep yourself healthy. So you just need the normal like exercise, like just to move your body. Our bodies was designed to move, not to sit.
Yes.
By the way, so this is like walking every day, or if you can like doing like soft running, it's okay. Jogging, cycling, those all are swimming. We are in session.
That's
swimming.
A good one.
Yes, this is a good one. And swimming is some kind of sport that almostly like move every single muscle in your body. So this is a moderate or modest lifestyle or physical exercise. It has to be your lifestyle, not exercise because you are aiming to lose weight or to know your exercise to live healthy.
For a healthy lifestyle.
Yeah, exactly.
C'est ça que le docteur peut dire, bon matin, ou pas faire exercice pour le corps, mais pour rester healthy, rester en bonne santé. So capable tous les jours, 30 minutes maybe each day?
This for adults different than children. For children, they need more exercise. Like we say, for children or like children, adolescent, 1 hour every day. Okay,
1 hour every day.
1 every day. Yes. For adults, 30 minutes a day. This is a bottom line. Like if you can go for more, it's okay.
It's okay.
For adults, 30 minutes a day for 5 days a week is enough. Okay, this is a bottom line.
Can they alternate the 5 days?
Yes, you have 5 days a week. You can alternate. You can take like week, Saturday, Sunday off. Alternate as like, because the day you have rest. If you are a regular exerciser, the day you take rest, your body will not fall into obesity,
yes.
and your metabolism will still be on the same high rate as your just a rest. Okay, but if you can go more, it's okay. But it's also recommended not more than like 1 hour a day for adults. Not banned, but not recommended. Just because you don't need to feel fatigue, you don't need to use your muscles, your knees, your joints. So 30 minutes to 1 hour a day. The bottom line is 5 days. It would be enough for adults. Yeah.
Let's talk about the weight. When do we consider it falls into obesity? The weight, how many kilos?
Exactly. Obesity, again, we are different. We are different in races. We are different in heights. We are different in many aspects of our life. So our bodies also are different. So there is no ideal weight for all people. Everyone has his ideal body weight. relying according to his height, to his race. So there was on the over the past decades, there was like many researches and many models as designed to describe the ideal weight or how to measure your ideal weight or your ideal height. But recently there are many modalities and many tools, but the simplest and the quickest and also very reliable tools. First one is the body mass index.
Yes.
The body mass index is a ratio between your weight and your height. This can show the slides. Is just for slide number 1. Okay, so this the body mass index is a ratio like you can calculate. You can use it on any application. There is online calculator for body mass index. You should you can just put your weight and your height, and it will give you your body mass index.
Body mass.
Okay, and also it can show you whether you are obese or you are overweight or your ideal body weight or even your underweight. Usually the body mass index we calculate it by dividing your weight in kilogram divided by your square height in meter. This is very important to put the units kilogram or meter. For example, if you're like 60 kilogram and your height is 160 centimeter, you divide 60 divided by 1.6 square. 1.6 times 1.6
to get the result.
To get the result, it gives you a number. This number is a ratio between your height and your weight. This number will show you this your body mass index. You put it on the scale. The normal is 18 to 25. If you are between 18 and the number you will get. If it is between 18 and 25, you are normal body weight.
This is the normal body weight.
The normal body weight, yes. The normal body mass index. Okay, so your weight is normal to your height. If you are more than 25, you're overweight. You call it overweight. If the number is more than 30, you are obese. And there is stages of obesity also. There is moderate and there is morbid and there is extreme. Like if you are more than 30, if you are more than 35, you are morbid. If you are than 40s, you are extremely obese. Okay, so this all the number of the body mass index. Why? Because some people this measure because some people are taller than others, so the weight should not be the same for everyone in the same age. It's just a ratio between the height and the weight.
But you have to be careful though.
Sorry?
You have to be careful though.
Yes, of course. Yeah, yes. Even if you are ideal, even if you are ideal body weight, you still have the risk to put weight in the future. It just means that you can eat freely and I'm fine and that's it. And I'll say no. As a must, I said the physical activity and your diet. Okay. There is also another indices or measurements how to measure your ideal weight, because this body mass index it applies for most of people. But for example, some people some subgroups that can't apply those body mass index on them, because for example muscular people, like if you are doing some heavy exercise and they have big muscles, those ones their body mass index might be they might be high, but still they are not considered obese, because the weight here comes from muscle. From the muscles. So then we develop some other measures to check this increased body mass index from the fat or it's the muscle, like the waist circumference. Waist circumference now is very important, very important tool to measure your belly obesity, or we call it the
section, what we call the middle section.
Exactly.
Yes. De la coup, si vous pouvez que nous tout le temps il y a un problème là quand nous dit dans nous middle section là tout le temps il y a un problème là qui nous besoin de faire très attention. Let's look at the questions. Doctor, we have some questions. Morning, Carol and your guests. For a long time, obesity has been on the rise in this country. Sorry, but there is nothing we can do. It's just that people love eating and they will accept no advice on this one, but will be angry with you rather than lowering their weights. It's total chaos. What do you think about this one?
Yeah, this is actually it's a true concern. It's true concern. Yes. People love to eat, but what I want to say here. To fight obesity, we should not tell people don't eat. Like I don't go with this concept, because also always it comes with an adverse consequence.
I think we are eating the wrong food.
Yeah, that's it, exactly. We don't tell people don't eat. You should not, because no one want to feel hungry. No, but eat the right food.
But it's what's on your plate.
Yes, what's on your plate, exactly, yes.
Si vous achetez manger, c'est get un coup. Comme il pas veut dire qu'on mange un tas, il pas veut dire qu'il pour ça, mais seulement c'est get what's on your plate. Si on a 5-6 bouillons, vous get what's on your plate qui est capable de causer un petit peu de direction, capable de changer, reverse un petit peu. What's on your plate? If there is 5 or 6 type of meats, just reverse it.
This takes us to the main point is the diet. Even nowadays, like the nutritionists, dietitians, they are already offering too many regimes to satisfy people's needs, because many people, they can't cope with the strict diet. So now, what is on your plate? You have to rely more like on. There is we showed before the balanced diet, how to have a dish with balanced diet, vegetables, carbohydrates, proteins, and less fats.
Good fats.
The good fat, yes, you consume less fat. Your energy should come from carbohydrate, protein, and fat, which you call it macronutrients, plus the vegetables where there is vitamins, fibers, and fruits also.
Fruits, vitamin C.
So you decrease the fat and use only the good fats. The good fats come from the vegetable oils, like the sunflower oils, the olive oil, and also the fat, the natural solid fat, like the butter and the eggs are natural ones. These are not so harmful. You can use, but also with moderation. Okay, so you can eat. We don't tell you not to eat or deprive yourself from something specific. You can eat everything, but with moderation, with balanced diet. Also, if you want, like, to go, for example, if you want to go for a junk food, when you buy a whole meal, like composed of some rice, some chicken, some vegetables, some salad, this is much better than getting, like, fried chicken and chips. Okay, we don't say also stop completely fried chicken and chips, because people will still need it. But
you
this
don't
is
eliminate completely.
Completely, yes. But just adapt better.
Reduce it.
Yes. Because it's a whole life to live. You can't live your own life without like depriving yourself from specific food. But what we say, adapt more the healthy options.
Another text, doctor, that says, good morning all. She says, Carol, I'm not obese, but I can't have children. Ask doctor what is happening now. Can you help, doctor? Not obese, but she's being unable to get pregnant.
Okay, this is a question. Yes, okay. Because infertility, you don't want to convince you. Infertility is not a consequence of obesity, okay? Or difficulty having children. There are so many causes for this. There is some hormonal assays. There is some local, like, or we can say local problem in the genital system. Maybe she need to check her hormone assay. There is too many tests they do. The gynecologist, they see first of all, they see if she never had children before, so she has to check the hormone levels, like the sex hormones level and the fertility hormones in her blood, and see, like, there is also the milk hormone. All those has to be checked first. If they are all normal, she has to do some scans, and she has to, on her, like, uterus, ovaries, to see is the ovulation of her normal, like, she has a normal ovulation or not. The eggs and the ovaries are normal or not. So all those can be a possible cause for infertility, and need a thorough investigation with her gynecologist. Okay.
Another question says, did COVID-19 have an impact on the number of obesity cases in Seychelles?
This is the usual question. But actually, this statistic, we still don't have like survey for 2023 for the prevalence of obesity. This might show up by the end of 2023. But again, the international data show some of impact, because people
have an impact.
Yeah, because people has to stay at home for a long time. They were banned from doing exercise.
Closed down.
Yes, the lockdown of course affected. So as a logic we can say, but to have data still 2023, then the statistics is still going on.
I will take another one.
But again, till 2022, I'm saying every year there is a rise of obesity amongst the school children. This is the data we have proven already.
Is the Ministry of Health is collaborating or maybe discuss having discussion with the Ministry of Education on this?
Yeah, there is already a school health unit, okay, and there is this project is done by the Ministry of Health in collaboration with the Ministry of Education, with public health authorities. Yeah, of course, because this is the obesity once it started in the children means that the adulthood also will be increased.
Will be increased, yes. Nowadays, a lot of Seychelles are following following intermittent fasting. Is it a good practice?
The intermittent fasting, it proved effective in, of course, in fighting obesity, but it depends on how you will follow it and the fasting hours. The fasting hours you will adapt, because this is one kind of strict diet. It should be under observation or supervision of a doctor or nutritionist, I think nutritionist or dietitian, because the fasting also there's some impact if you adapt it for a long time. There is some vitamin deficiency if you don't eat enough vitamins when you do the intermittent fasting, and also the blood glucose levels might fall if you adapted long times or long hours of fasting. So it should be under supervision and should not be for long time. Those kind of strict diets should be aimed for those people who want to lose some weight or rapid weight reduction for a health condition. Like if you are, like I said, if you are like having body mass index more than 35 or 40, and you have, for example, you are diabetic or you're hypertensive and you need to lose some weight to better control blood sugar or blood pressure, you can adapt those kind of strict diet, because those strict diet anyway you can't go with them for long.
Yes.
Yeah. After all, you will fail. And when you fail, or if you, after stopping this, some people they relapse because they deprive themselves from food for a long time. Now they relapse. They are more hungry. So this proved effective. Like there is many different regimes for diet. There is low portion diet. There is intermittent. There is keto diet. So it's better if you want to go with this to follow his nutritionist, or if you're not, you should not like go for it for a very long time. Okay, and make sure that you don't fast for long hours or deprive yourself from.
That's me.
Okay.
I'm very strict. Sometimes I do severe regime.
Okay.
But then after.
But you make sure you take vitamin supplements with this.
Vitamin supplement, water. That I will go like this for 3 days, and then I come back.
Okay, that's good. And one more important is how to maintain the weight after weight reduction. This is the most difficult part, because losing weight, especially early, it's easy. But after losing 10% of your body weight, then the weight reduction becomes very slow and very or need more exercise or need more efforts. So how to maintain that after? Either you continue your life on this strict diet, which is impossible for almost all people.
For almost everyone.
Everyone.
Yes.
The other thing is exercise.
Yes.
Exercise. You have to keep, after you reduce your weight and you on one of those diets, like strict diet regimes you're on, then you have to continue on the balanced diet. As we say, eat normal, eat everything, but with moderation. Yes. Less fat, less carb, more vegetables, more fruits, and proteins, of course, and the exercise. As long as you're exercising regularly, you will live healthier.
It shouldn't be a problem either.
Yeah, but you know, it will make you healthier and even less prone to have like chronic disease, even if you have some weight. Like even people who have like overweight, but they exercise regularly, they will live healthier. Of course, yes.
Which bring me to this question: what impact does mental health issues like emotional eating have in relation to obesity?
Okay, there is complex relation between mental health and obesity. Like, you know, obesity leads to some psychological stress or some psychological imbalance, which can even go up to depression in many persons, especially the teenagers. Like they are not happy with their body shape,
body
with,
shape, yes.
especially among us, their colleagues or pals. So they are not happy. So they are locks themselves. They are unhappy and unsatisfied, and then they might have depression. And depression makes them eat more.
Yes, there are depression that you don't consume anything.
Yes, and
but
there is depression that they eat more.
Everything.
They eat everything, and they become more fat, and we go into a vicious circle, like from obesity and depression, and obesity and depression. This is a condition. Yes, this is very very well known condition in obese people who have depression, and some of them even they eat like as a kind of like revenge, like
yes.
The food makes okay, I will eat more, that's it, or
I will
just
kill
okay,
you the food. I will kill the food.
like something like this, or okay, I don't care about the society, I will eat whatever. So this kind of like self-denying. But so this is the impact of food, of obesity on psychological method. And also if some people have already psychic or psychiatric disorders, they will be obese because they will exercise less, because many of those people, they can't go outside, or maybe they have sedentary lifestyle.
There is one vicious word, lazy.
Lazy, yeah.
Right. There are people who don't do any exercise at all.
Yeah, I mean, many of us nowadays like this. Yes.
It's just the laziness.
Exactly, laziness. You go to your work by car, you sit on your desk.
Even you go to the shop by car.
Yes, you go to the shop by car, you go home, you eat while you are lying on your sofa watching TV, and this is your entire
one full day.
Yes, this is your daily regime.
This is where
exactly
your midsection.
Yes, the midsection, exactly. And this is proved to be very, very, very dangerous. The belly fats, even in people who are not obese. Like we see some people that they are not obese. If you like as a whole, they are not obese and their weight is ideal, but they have this big belly.
Yes.
This is very dangerous. This is called like male obesity, or we call it the belly obesity, as you say, because there are proof that this fats in this area is the most stored fat, and they are most dangerous for the hormone imbalance and hormone disturbance happening in our body, happens in this belly fats.
Ban de ti moun ki la kou, ban ki sito ki konta ban zot televizyon, ban ki konta asiz epele tan, pare nou di the middle section ki gen affecté, pare dokter indi il vine gros problème. Pare ki nou di ban la pang, pare nou di ban la pang nou bizne fè façon tire sorti un peu de sa bonne Paris, pare nou di fè un petit peu l'exercice, essaye au moins commence avec 30 minutes par jour, après avoir increase 45 minutes to 1 hour, comme ça il va bâtir un petit peu quelque chose à cause il capable de danser, ça quelque chose là trop gros, ça qui nous dit obèse aussi, il pas bon, il y a des gens qui disent les autres belles, autres gros, autres oversize, which bring me to this one. There is obese, overweight, oversize, supersize.
Okay.
Those 4 words.
And actually, it's called like overweight. As I said, it's all depends on the stage of obesity, based on the body mass index. You go like overweight when your body mass index is more than 25, more than 30 you are obese, 35 morbidly obese, and 40 is extremely obese.
Extremely
obese. Yes, more than 40, and those like more than 40 usually is a kind of obesity or stage of obesity that require some kind of surgeries or pharmacological or treatment by pills. What can you say?
Surgery. I know that there will be the gastric bypass or the bariatric surgery.
Now there is a lot of bariatric surgery options now for according to every patient's condition.
When do you recommend surgery?
Sorry?
When do you recommend surgery?
No, actually it's by bariatric surgery bodies, international bodies. They recommend it in certain situations. Not everyone who is obese goes for surgery. They usually recommend it in the body mass index is more
to lose
than
weight first.
No, and also depends on the body mass index and your health condition. Like some people, usually it's recommended over 35, over the body mass index more than 35. Like till 35 is not recommended unless you have a health condition. Like some people who are like, for example, have some health condition like heart failure or some kind of those surgery heart conditions, or have some knee problem, they have surgeries on their knees or something, so they can't exercise, they can't adapt. So those people, and they are morbidly obese, like they have like body mass index more than 35, those they are recommended for surgeries. For those bariatric surgeries, because it's a surgery, it's kind of surgery also. It has some risks, some complications, some side effects, but it's, yes, it helps people who are like having like very huge body weight, and they have health condition that they prevent them from exercising or adapting healthy life, and it leads to rapid, yes, weight loss, especially in the first few months.
Childhood obesity?
Childhood obesity. This is the first thing we spoke about now today. You know, why we focus on childhood obesity? Two things. First of all, children should not be obese because by nature they are children, so they, they are physically active. They should be active, like they run, they play all the day, so they are physically active.
Then why is it a problem?
It's a problem. Why? Because again, the recent research has showed that those complications that we talk about, like diabetes, hypertension, heart diseases, which is a leading cause of death worldwide, heart disease, and all those fertility issues or infertility, all those conditions that are like consequence of obesity, they have high possibility to develop when the obesity is for longer time. The longer you're obese, the longer duration or longer life you are obese, the more risk for complication you can have. Like if your obesity started from your childhood, you have higher risk to develop diabetes or hypertension or heart problem in your adulthood. And when the obesity, but on contrary, if the obesity started later in life, like late in adulthood, the risks will be much less. Because all of us usually we tend to put weight after the age of 35 or 40.
Yes.
But this is a normal progress of our bodies. That's why the risk of having those diseases will be less. But those who start being obese from childhood or teenager life, of course, they will have higher risk of developing diabetes or hypertension. That's why we focus on children. And adolescents not to be obese. But here also I have to say something very important for children obesity. The children, when we deal with children obesity, we don't tend to like aggressively lose weight like in adults, okay? Because also severe weight reduction or rapid weight reduction in children is not healthy at all, because their bodies are growing, so they need all minerals and all nutrients. Of course. So even fat they need it in the body. But what we aim for is to stop or to slow the weight, the increase of weight. So for example, if a boy like his body mass index is 25, what we need is to stop his putting more weight. And when his body grows, like his height will grow, his muscle will grow in this area, so it will fit and match his weight. So we don't lose weight, we just stop or maintain his weight, stabilize his weight. Yes. And when his body grows up, it will fit or match to this previously supposed to be a heavy weight. But we don't in children, and so on, is not healthy at all to reduce their weight aggressively or rapidly. Unless there is some health condition like have diabetes in young age or something like this. This is another issue, but we'll talk about the majority of the children.
We have one question which is in Creole.
Okay.
Bonjour Carole. S'il vous plaît, demande docteur quoi qui empêche la pesée descendre à cause mon contrôle bien mon diète, mais il tarde descendre seulement le corps il look slim, les yeux que juste la pesée là. Do you understand it?
My mom said what?
You said this one is said to ask you what causes its weight to do not she or he, I don't know if it's she or he, she or he's having difficulty to lose the weight, but she's not obese. She or he's not obese. She or he is slim, and that the clothes fits well on him or her, but it's just the weight that it cannot goes down.
So if he's slim, why he wants to lose weight?
Maybe
I advise you, if you are slim and if you are fit, and if you are, again, because it's now some people also, we don't want to make people are like, crazy about losing weight and being very very slim, something like this. You should be in an ideal body weight. Just calculate your body mass index. If it is normal, so you don't need to lose weight, you should just eat healthy and exercise regularly. If your body weight is ideal, okay. Again, but if you found that your body mass index is more than normal, more than 25, this is the cutoff we mentioned. Check your diet. Do you exercise or not? Does he exercise? He didn't mention he exercise or not.
No.
What kind of diet was he's adapting? Eat less fat, eat less junk food, eat more cooked food at home, make your balanced diet, eat like more vegetable, more fruit, drink much more water. Water is proved to be to help for weight reduction, by the way, even on resting condition, because there is energy consumed to digest water and this, and
yes.
it will
try to change a little bit of your lifestyle. If you are not doing exercise, try to do some exercise. Maybe just try to change your lifestyle. Try to do exercise. If you are doing it, maybe it's not enough, or readapt your exercise type of exercise you are doing. Maybe the body is already adapt to those kind of exercise. You need to change that.
Yes.
You need to do some variation now in your exercise, maybe.
One more thing also, when you exercise, after a while, your body will stop losing, because your body, as you said, adapted to this high metabolic rate, high exercise. So the weight reduction rate, the rate of weight loss will be slower. And one more thing, when you exercise, your muscles grows and your muscle put weight also.
Yes.
So it's not only about your weight on the scale. It's also about your height, about your this weight is that's why we said that the waist circumference. Measure your waist circumference. If you are a man, like it should be less than 90. If you are 94, if you are a lady, should be less than 80. The waist circumference, because it's a good measure for this weight, is more muscle or more fat. Like if I'm telling you, if you are athlete, if you're exercising a lot, so your muscles will grow up and it will put weight, but your waist will be slim. But if fat usually tends to store here on the belly section. Or the middle section, exactly. So all those measures will help you to decide whether your body is ideal or not. If you are ideal, so no need to lose weight.
Get to savoir quelque chose qui docteur dit, il faut faire un petit changement avec ou lifestyle, là faire un petit changement, faire par exemple une variation peut-être avec dit si on dit monde qui slim, on pas supposer date inquiète mais souvent ça la pèse qui pas descendre 10 faire un petit changement avec ou lifestyle. I will take the very last question. Doctor, this one says, what is your opinion on liposuctions?
Everyone wants to go for surgery now. Yeah, liposuction is,
yeah.
Okay, liposuction of some kind of procedure do for local obesity, like here. Yeah. I usually advise for the like natural like exercise and diet, the natural ways to lose weight. But still, some people, yes, after doing those, even after losing weight, they will still have some areas where the fat deposition, because this is genetic, by the way. This is inherited in their blood. There's nothing, and those central fats is the least to remove from the body. So those people, if you are already have tried everything, diet, exercise, everything, and you still have some areas, okay, you can go for liposuction, but should be in a well-known place.
You need to consult the doctor.
Consult a doctor first. You need also to check your hormones, like your general health condition. If your doctor gave you the go-ahead, it's okay. You can go for it, because it's more about removing fats from some areas in your body and shaping your body well. This now it's considered a kind of not bariatric surgery, but some kind of shaping of the body, but still there are some proof that it's it will help it's healthy procedure, because as we said, the central obesity is very, very dangerous. So removing the fat from this area it will help you to also reduce the risk of some medical condition or some diseases that you might develop later on.
Dr. Mahmoud, it was an absolute pleasure this morning to have you to talk on obesity, which is very alarming in Seychelles. I don't know if we will meet again before the end of the year, which I suppose. I think you are on schedule before the end of the year. But have a great day today.
Thank you so much. Thank you.
Thank you so much. Aussi de la cour, nous peux causer le topic obésité aujourd'hui avec Dr. Mahmoud Farouk qui nous a demandé, qui nous peut causer un petit peu là, d'ailleurs qui alarmant ici, c'est celle qui nous besoin aborder un petit peu ça c'est même depuis des enfants l'école jusqu'à des adultes. Alors s'il vous plaît, on nous fait un petit peu l'exercice, on nous fait un petit peu variation sans nous lifestyle un petit peu manger concerné de la cour de place de la journée à des fast food ou des junk food qui manger de la cour il plus healthy à voir si ça n'a pas les sons. On empêche nous à tomber de ce système qu'on appelle obèse. Après nous parle de oversize tout ça là. Alors ça c'est là nous just be careful, be very careful avec nous la santé à cause c'est important pour nous rester healthy. C'est ça une conversation pour la bon matin.